be mindful of that. I think the scale of the intervention we've done fiscally, as I said, is more significant than almost any other developed country, and I think we've done it in a targeted and effective way that will be most beneficial to businesses. To your second question, as I said, we've been very clear at this stage of the crisis. We are absolutely focused on sticking to the guidance. We have, the First Secretary set out 5 tests last week, so for us to think about moving to the next stage. We are not there yet, and so it's very clear that for now what we should focus on is following the guidance, staying at home to protect the NHS, and I think anything else that people might be speculating on is wrong. We're crystal clear on that message. And then perhaps on the data, Yvonne, would that be you to handle?
Thank you, Chancellor. So, Robert, yes, undoubtedly the hospital data do not tell the whole story of total deaths. And this week, as for last week, we will have a comprehensive view of that later in the week from ONS. I don't know whether 40% is a correct figure. I couldn't really say that, but I would expect more. And we know now from looking at the pattern that 9 out of 10 deaths do occur in hospital. What I do feel is that the burden of mortality outside of hospital isn't evenly distributed throughout the country. It will mirror where, for instance, there may be more care homes or more hospices. So we'll see an uneven pattern of that, but we'll certainly know for sure later this week what the comprehensive number is.
Brilliant. Thank you, Yvonne. Thank you, Robert. Can we turn next to Beth Rigby from Sky?
Thank you, Chancellor. A question first for Professor Doyle, if I may. Some of the bodies representing medics are deeply concerned that Public Health England have downgraded PPA guidelines on Friday based on the availability of equipment rather than safety standards. Do you acknowledge that NHS staff are potentially risking their own safety to look after patients? And just to the Chancellor, you've put the furlough scheme in place until June. You now have some idea of take-up. Can you give us an estimate of the cost, and will you extend it further if necessary?
Thanks, Beth. I'd say we don't have an estimate of take-up yet. It's just the first day that the scheme is opened, and as I said, I expect those numbers to continue to increase over the coming days, and I'll provide regular updates on them. I think the OBR set out an estimate of costs last week, which I would refer you to, and we did extend it last week. Given where we are, and given where we are in the crisis, and given where we are in the state of the economy, I thought that was the right decision to provide some long-term certainty for businesses and security for their employees. I can't tell you now what the future will look like. We keep these things under constant review, and it will depend on the evolution of how we move through this crisis and move to the next phase. And I think with your specific question on PPE, Yvonne will answer, but I would say I think in all cases, we've taken advice and guidance that is in line with the WHO, the CDC, and Public Health England, but I'll let Yvonne answer specifically.
Thank you. Absolutely, Chancellor.